Hi, my name is Monica Buchanan. Welcome to the second segment of Healthcare for Children and Youth. Advise the child's social worker if the child in your care requires medical attention or treatment. Ideally, you do this prior to treatment. However, in exceptional circumstances when this is not possible, tell the social worker as soon as possible afterwards. All medications, over-the-counter drugs, and vitamins given must be recommended by a medical professional and recorded in the child's logbook and health care passport. If these medications or over-the-counter drugs are routine, ask the child's social worker to include them in the care plan. All medical treatments for children in care must be approved by a physician and authorized through the Medical Services Plan or Pharmacare. In order to ensure you are reimbursed for any medical services or supplies, ensure you receive authorization from the child's social worker prior to the expense. If you believe that an alternative therapy might be appropriate, you must receive approval from the child's social worker. Ask the child's social worker to include in the care plan the practice to follow if the child or youth refuses prescribed medication. Make every effort to notify the ministry immediately of any emergencies that seriously affect children in care. However, do not wait to seek medical attention in an emergency. If the child's social worker is not available, speak to the intake worker or the social worker's immediate supervisor. Voicemail is not sufficient. If you have a child in care who is medically fragile, you may ask the child worker to ensure the care plan states when a critical incident report is necessary or when routine reporting is sufficient. If an emergency takes place after office hours, contact the ministry's after-hours line at 1-800-663-9122. Children in care require dental examination as recommended by their dentist on average every 6 months. A Pacific Blue Cross benefit card will be provided for you by the child's social worker. You can make appointments with the dentist directly and they will bill the insurance company for the appointment. If the dentist is not able to bill Blue Cross directly, please contact the child's social worker immediately. Please note that there are some differences in dental programs for Aboriginal children. The child's personal health number and Blue Cross card are necessary for eye exams. The child's social worker can tell you how the optical plan works if the child in your care requires glasses. For special medical needs such as prosthetics, medical equipment, transportation, or similar such things, check with the child's social worker and obtain approvals for these expenses prior to making any appointments or purchases. Any questions about assessment, developmental supports, or mental health services for the child in your care should be directed to the child's social worker prior to making any appointments. It is recommended that foster parents use standard precaution when providing physical care for children in care. Standard precautions, formerly known as universal precautions, are the steps that should be taken to protect anyone when they are exposed to blood or bodily fluids of another person. Standard precautions are intended to stop the spread of infection to others. Hope you enjoyed this segment of BC Foster Basics. If you need further information or assistance regarding healthcare for children and youth in care or any other fostering subjects, please call us at 1-800-663-9999 or check out our website at bcfosterparents.ca. Also, please don't forget to visit the BCFFPA YouTube channel regularly for more topics in BC Foster Basics series. Topics such as foster parents' rights, agencies at your service, and many more.